Some gifted individuals have life insurance and access to hospitals. However, many individuals in rural communities worldwide are facing multiple issues on a greater scale, such as hunger, lack of education, sheltering, etc. But the most dreadful is the lack of health care. As a result, thousands are suffering and dying from health-related issues every day. In fact, 3.8 billion people lack access to basic health care. They instead have to keep working and going on with their lives with life-threatening illnesses and diseases. Dr. Nigel, a professor at Harvard, has been studying this epidemic for several years.
Many rural communities do not have access to healthcare for their citizens. As a result, citizens cannot be cured from diseases or receive medications for their illnesses. In Zimbabwe, the childbirth is very suspenseful. Sometimes the newborn would be born with a congenital disease that couldn't be treated and resulted in the newborn's death. Civilians in third world countries cannot escape these problems because of the issues that they are faced with. This is because more pressing matters are being enacted upon them, such as food and water. Due to their negligence, infectious diseases such as lymphatic filariasis, Chagas disease, leprosy, guinea worm, onchocerciasis, and schistosomiasis. These so-called neglected diseases predominantly affect poor populations in low-income countries and pose particular social and economic problems for those affected. In addition, the lack of healthcare in rural communities results with the lives of innocent people being lost and people dying of curable diseases. Many communities in the United States receive enough money to give access to healthcare for their citizens. However, these rural communities don't only occur in third world countries. Some occur in parts of America that deal with the same problem. The major problem for healthcare is the price. Low-income communities may not have enough money to buy healthcare. Many people are oblivious to the healthcare rural communities don't have. Without healthcare, rural communities cannot provide safety from diseases or medical events.
However, recent programs and initiatives have begun all around the globe to fight the battle against access to healthcare. These solutions have been studied and investigated thoroughly by Dr. Raj, a professor at Cape Town University in South Africa.
I've been trying to find solutions to these healthcare issues prevalent in society today. One of the key reasons why access is even limited is because of the major medical organizations withdrawing from these low-populated cities. These corporations are using their medical staff elsewhere in large urbanized cities to satisfy their minor needs. The simplest fix we have to this catastrophe is by bringing medical aid to rural areas and some healthcare infrastructures. An example of this would be the medical colleges supporting rural areas. Many of these America's top medicine colleges are aiding rural lands globally. To address the shortage of primary care physicians, students train in several rural communities. The establishment of these medical facilities is contributing toward the access of healthcare. People who live in small towns of a couple hundred people can go to a local clinic and receive the medical care they need. In addition, these young individuals at the university can now treat real people and obtain experience before entering the workforce. Another group that requires aid are citizens in third world countries who do not even have proper access to water and food. These needs are more concerning to them rather than becoming sick or contracting diseases. To ensure that these individuals do not contract such diseases, voluntary medical organizations are traveling all across the globe in order to help their patients out. In fact, organizations such as the Red Cross are making over 96,000 health and mental health contacts annually across the globe. With these solutions underway, millions of lives are being saved internationally and would have not been saved otherwise. Men and women worldwide are helping each other out by compromising any profits they could have made. With this commitment, impoverished communities are healing and rejuvenating from these